Right. Well, hello everybody. It's marvellous to see so many people here. I'm really very grateful to you all for coming. It's a fantastic turnout. We should be really proud of ourselves here in Wirksworth. As you all know, the NHS, or the health service in England, should I say, is an important election issue. We have an excellent GP service here in Wirksworth and in the rest of our constituency. And they're under great pressure. GPs are under great pressure, as is the rest of the health service. And this is especially so since the Health and Social Care Act has come into force. So we decided as a group of concerned people in Wirksworth that we wanted to put on an event to support our local health workers, GPs, nurses, all the rest of them, and to make sure that we don't lose what we value so greatly. So we've invited candidates that you can see here on the platform, and we're very happy to see the people who are here to answer our questions tonight. So we have Patrick McLoughlin at the end of the table, who's our Conservative candidate, Ian Wood, who is from the Green Party. I'll leave out the chairman for the moment. We've got Ben Fearn. Nice to see a young candidate, that's brilliant. And Andy Botham, who's our Labour Party candidate. And Ben Fearn's the Lib Dem candidate. Well, you can see at the front of the desks anyway. And also, we're very grateful to Andy Miller, who's sitting in the centre, who's going to be our chairman tonight. So just a little bit of housekeeping before we start. Most people will probably know that the fire exits are as marked, one at the back, one there where you came in and down the main stairs. The one at the back takes you out at the other end of the building. And there's also one, if necessary, through where the bar is and down the stairs there. We have got two fire marshals at the back of the room who will put on a yellow jacket if necessary and lead you out. We're just carrying out instructions from the fire inspector. We're also doing a film recording of this event, and that's because some people may well have not managed to get a seat tonight, and we wanted to give them an opportunity to see the proceedings. And also, if you want to look back at it later and see if you missed some of the answers. So you can watch the film recording on YouTube. It'll be available from this coming Monday. And there's some slips on both the upstairs desk and the downstairs desk showing you where you can access it on YouTube. We're very grateful to George Peck, who's at the back tonight, for recording this for us. There will be some costs from this event, and if anybody would like to give donations, we'd be very grateful just to cover the costs of putting on this event. So that, again, on the two tables upstairs and downstairs, there are collecting buckets. So please just give us some of your money just to keep this kind of activity happening in local communities. So I won't waste any more of your time. There's been a lot of questions handed in, and we're very grateful to everybody for spending the time to put their questions in. Obviously, as you know from question times that you might have watched on the television or seen on the radio, only a few questions can be asked and answered. So we've had to pick some of those questions. We've categorised them and then picked a representative question from each of the categories. And the main topics are the Health and Social Care Act, the Transatlantic Trade and Investment Treaty, privatisation of the health service, affordability of the health service, consultation with staff about changes in the health service, future staffing, and mental health services. So if your question hasn't been read out, we're very sorry, but hopefully you'll be able to join in the discussion which will follow each question. So I'll pass you on to Andy. Here are the questions.
Thank you, Jill. Thank you. Thank you very much, Jill. Welcome, everybody, again. As Jill has said, we've got a number of questions here. She's read out the topic areas, and maybe I'll read them out to you again before we start. The way we're going to do it is I'll ask each of the candidates to reply to the question, and we'll give people a maximum of 3 minutes for that each for that task. If we don't need 3 minutes, then that's fine. I'm asking everybody on the panel here to be succinct tonight. So a 3 minute maximum for reply to the question. Then I'll ask for comments, responses, or whatever from members of the audience, and ask you to make those comments within a 2 minute bracket, please. Hopefully that's plenty of time. But the more succinct we are, the more paced we are, then the more able we will be to get through more questions and for more people to speak. There's a lot of familiar faces to me here in this room from Wirksworth, but there are also people I don't know as well. What I will attempt to do is give everybody who's got their hands up a chance to speak. I'll attempt to do this, depends on numbers, to speak at least once tonight in terms of one of the questions. So I think what I'm trying to say is if somebody's got their hand up all the time, I won't be asking you all the time. I'll try and make sure that everybody around the room gets a chance. So, as Jill said, it's wonderful to see a turnout like this. It's part of the democratic process. We've got a general election coming up, and it's good to see people involved in the political process and in discussion. So that's excellent. If I could just say, and I probably don't need to say it, but I've talked to the panellists and we've all agreed that we'll conduct this in a courteous way, give people a chance to speak and be listened to, and we'll make our points, or people will make their points rather, forcefully if needs be, but politely. And can I ask that also of the audience, please? You're very, very welcome to contribute, but can you please make your points when it's time to make them, rather than whilst other people are speaking, and also make them courteously. We'll play the ball and not the player, okay? And the more we adhere to that, the less interruption we get for settling everything down, and the more we can get on. So those are the kind of ground rules we want to know.
Could I just ask if everyone's got their phones on, turn them off? We're picking up some
I'm using a phone to see what the time is, Rob, but it's not. It won't ring. Do you want me to switch it off? Okay, we're sorted.
That's it. I'll put it there.
I'll also ask, when I ask questions, I'll ask candidates to respond to them in a different order each time, so it isn't the same person going first and the same person going last each time. So, we know what we're doing. Let's kick off with the first question. And before I do that, I'll remind you of the categories again, so that if we're answering a question about the first category, which is the Health and Social Care Act 2012, we don't wander off into other areas which are going to come up later. So if you've got comments to make, perhaps you could just say, well, is it pertinent particularly to this area, or is it more pertinent to question 3 or question 4? You know what I mean? So we've got Health and Social Care Act 2012, we've got TTIP, which we will explain, we've got social care, we've got issues about privatisation, we've got issues about affordability. That's right, isn't it, Jill? 5? 1, 2, 3, 4. 5 here.
Let me see how we go with this one.
Should we get on with the first one?
Yeah.
We'll get on with the first one, and there may be some more arriving. Okay. So, question 1: Health and Social Care Act. This is a question from Moira Knowles, and it starts with a quotation here from David Cameron. It says, "So let me make this clear what our reforms won't look like. We will not persist with the top-down restructures and reorganisations that have dominated the last decade in the NHS. They have caused terrible disruption, demoralisation and waste." And that's dated as Thursday, the 20th of August, 2009. And then Moira's question is, in relation to that quotation, would the panel agree that it is corrupt for a government to reorganise the NHS, costing £3 billion and causing terrible disruption, demoralisation and waste, considering the assurance that this wouldn't happen was so vehemently stated to the electorate ahead of the last election? So, in terms of order, I'm going to ask Andy Botham if he'd like to reply to that first, and within 3 minutes, if you could, please.
Thank you, Andy. This brings to mind a recent question time where I saw two politicians complaining about the difficulty of having a coalition government and being able to implement the issues that you put forward in your manifesto. The problem is the Health and Social Welfare Act, the Social Care Act, was in neither the Conservative or the Lib Dem manifesto. So it wasn't a difficulty in bringing forward their policies. It was a policy that neither of them had brought to the table. It was a policy that neither party had been elected on, but it was a policy that they implemented quite early on in the Parliament. And quite rightly, as Maura says, it's been a top-down reorganisation of the National Health Service that's cost £3 billion. £3 billion that didn't need to be spent on the reorganisation, £3 billion that could have been spent on providing the services on the front line. And the Labour Party have been quite clear, and I think Ed said again today, that in the first Queen's speech, should we be elected, we will repeal the Health and Social Care Act 2012. We don't see the need for it. We don't see the need for opening up the National Health Service to privatisation. We don't see the need for allowing services to be taken, the profit to be taken, and the damage that it does. We certainly don't see why a coalition government brought it in. There was no need for it. They didn't say they was going to bring it in, and nobody asked for it to be brought in. That £3 billion could be spent elsewhere providing the services. It could be spent providing doctors, nurses. It could be spent providing care services for people. And we have opposed it from day one. And I hope in a moment that my two colleagues on the table here will explain why they saw the need to implement such an act when they never mentioned it. And in fact, they specifically said that they would not do it before the last election. So that's about it, Chair, for me.
Okay. I'm going through in alphabetical order for this first time through, alphabetical order of surnames. So I'll ask Ben now to reply to that as well, please.
I'm going to be very frank and honest. I was against the Health and Social Care Act in 2012. I remember opposing it at the Gateshead Party Conference, the Spring Conference of that year. But let's be clear, the Health and Social Care Act did not introduce competition into the health service. There has always been a private element. Andy Burnham, I don't know if you know this, Andy, or not, he said on Newsnight recently, there is a role for the private sector. Now, this also isn't the first top-down reorganisation we've had. I'm not saying it's right, it's not. We've had plenty under Labour, a very costly IT system as well. But also, the Health and Social Care Act wasn't just put through willy-nilly. We got important concessions in it. So now the Health Secretary remains politically and legally responsible for providing a free at the point of use health service. And we're stopping the cherry picking of services. And also, I don't know why this happened, but the Labour government allowed private companies to spend £250 million over private companies for operations they didn't even carry out, which I don't understand at all. But there's always been this private element. And I have to say, Andy, you call yourself a socialist, correct? You do?
Proudly.
In what sense, then, was the PFI schemes, the privatisation of Hinchinbrook Hospital in 2009 under Andy Burnham, and also the contracting out of 4.4% of NHS, in what way was that a socialist policy?
Well, I'm not going to ask people to reply to questions on the panel. Let's take that as a rhetorical question, shall we? And I should have said also that when we have comments from the audience later, please don't make those as questions to the panel, because we're not going to come back to the panel again after that. We're going to move on to the next question. We'll take that as a rhetorical question and let it hang for now. And I'm sure if you really want to respond to that one, there may be an
I'll find a chance,
opportunity
Chair.
to work it in somewhere else. Okay, well, people can't hear at the back, apparently. Okay, well, is that any better at the back now? You couldn't hear Ben.
I can say it again if you want.
We'll pass on. In alphabetical order, I'll ask Patrick McLoughlin to respond to the question now, please.
Okay. The Health and Social Care Act did a number of things, and I'm surprised to hear that Andy Botham is saying the Labour Party will repeal it. But if they repeal it wholestead, it'll also repeal quite a lot of the extra responsibility that we put on local authorities and county councils and give them the money thus to do so, as far as providing more direct care between the hospital and the patient. So I'm rather surprised that it's a wholesale repeal. But I think it also took quite a lot of managers out of the health service. So I'm not sure if the repeal that Andy talks about is going to bring those managers back in, because what it has helped us to do is actually put more people on the frontline staff. It's helped us recruit more doctors and recruited more nurses, which I actually think is quite important as far as the health service is concerned. That is why it was done. It was obviously done as a coalition deal. All the acts of Parliament we've taken through this whole Parliament have been a coalition deal, and it is one of the problems with a coalition when we don't actually know what the outcome of a general election will be if a party does not get an overall majority. But that's what happened in 2010, and the politicians, having sort of got into the position where no direct answer was given, came up with a deal which gave the government of the day a working majority, and we were able to take through the legislation that we needed and thought was necessary to take through to do the reforms to give, as I say, more frontline services. So we've seen an increase in nurses, we've seen an increase in doctors, we've seen an increase. Well, madam, shake your head. I mean, nobody doubts it. That is actually what has happened. There has been an increase in those. There's been a huge increase in activity in the health service overall. You know, I think the health service, when it's at its best, is brilliant, and when it's at its worst, it's really worrying and disturbing. And as somebody who knows incredibly well the SDGH, which is the Stafford District General Hospital, there, I'm afraid, we saw the health service at its worst. And we've taken measures through the clinical commissioning organisations to actually have proper inspections of hospitals and to take action quickly when those inspections show failings. And I'm pleased that we've done that because it needed to be done. And that is one of the things that is also in the Health and Social Care Bill. So there's a lot of things in that bill which Andy has said that they're going to repeal completely, which is something very new I've not heard before, for us to ponder.
Thank you. And finally on this question, I'll ask Ian Wood if he'd reply, please.
I used to be a lawyer, so when addressing large groups, I tend to stand up. And I apologise for you having to see more of me than otherwise you would have done. To answer the question, it's obviously not corrupt. However, it is undoubtedly dishonest of both the Liberals and the Conservatives to have done this. They assured us they wouldn't, and then promptly they did. And one thinks of recent assurances about VAT after the election that might similarly and with equal ease be broken. But the biggest mystery about this whole stupid act, which deserves to be repealed and which we would repeal, is that it's senseless. It is completely lacking in logic. It lacks commercial logic, it lacks business logic, and it lacks health service logic. There is no evidence, no reliable evidence, that competition from private organisations in public service organisations improves quality. There is absolutely no reliable evidence that that can happen. And there is no evidence, because I've looked from around the world, that it has ever happened. And yet for 35 years, we've had to put up with this neoliberal claptrap being rammed down our throats and foisted on the poor. It is absolutely disgusting. But on the particular process that these private companies go through, first of all, there is what I say about competition. I can't understand why they're doing it in the first place. Secondly, competition in order to get the job is done on price. So there's an element of competition there. But there's little heed paid to quality. So I would say that at that stage, that is the only stage of the whole process at which you could say there was any reasonable element of competition. After that, there is the purchaser-provider split, which would be the first thing we would get rid of. Dividing the service into two, in theory, is always the precursor to dividing the service into millions of bits in practice, which we're now seeing, incidentally, you mentioned Stafford, in North Staffordshire, where a couple of weeks ago, £700 million was paid to a private company to take over a cancer unit with equipment that was raised by the proceeds of fun runs and charitable donations. Surely the most cynical and disgusting action of this Conservative Parliament, this Parliament. And of course, the purchaser-provider split involves purchasers talking to themselves a lot of the time. There's absolutely no competition when you've got 27% of all clinical commissioning group members on the boards of private companies that they're selling their services to. And in any case, how would they cure that? Would they walk out of the room when the discussions were taking place? Would that make it okay? Because the whole idea of getting GPs and medical professionals in on the discussions was so that there would be a medical practitioner input into the commissioning process. So either it doesn't work and there's no competition, or it lacks that element. I've got more to say, but I have to stop.
Thank you, everybody. I'm now going to ask for comments from the floor. I won't read the whole question out again because it's rather lengthy, but just to remind you that it's to do with the Health and Social Care Act 2012. The gist of it is that it's been a reorganisation, expensive reorganisation, and that has gone against an assurance that was made before the last election. That's the gist of the question. Thank you, Jill. Yes, that's right. I was going to come back to the person who asked the question. So it's Moira. Where is Moira, please? Moira, would you like to respond? And again, we've got 2 minutes maximum for responses, please.
Yes. Well, firstly, the question was asked because I don't think it's okay for politicians to elect a mandate and then do something completely different. I think it makes us feel disenfranchised, and I think...
Hold the microphone.
Yeah, sorry. Yeah. It makes us feel disenfranchised if ahead of the election, and I've got about 5 quotes from Mr. McLoughlin saying he's not going to, not Mr. McLoughlin, from James Cameron saying he's not going to reorganise. So that was the first point. The next point is that £3 billion has been spent on a structure that isn't working. It clearly fragments the whole National Health Service. The left hand doesn't know what the right hand's doing. It's very complicated. We're told that there are less managers, but in fact there's more admin. There's more admin having to deal with the contracting out services, because what the Health and Social Care Act did was get rid of the primary care trusts and put in place what's called a clinical commissioning group. And that commissioning group has a remit. They have to put all the contracts out to NHS and private providers. And what that does is set up competitive tendering. It's very costly. It's loads of admin. And the other thing about it, which wasn't mentioned by any of the candidates, is the private companies are not actually monitored well enough. The staffing levels have only just been put into place. There were none to start with. The insurance for the private companies is still not, there is countrywide regulations on it, but the actual private companies get away with not applying them. And there's the Winterbourne Trust, I think it was called, the old people's home, that collapsed in a heap, and there was no insurance cover. It was an offshore account. I mean, I could go on about this restructuring. £3 billion. Marketisation, I also disagree with that, and competitive tendering. I don't think that should apply to health. It can apply to other things, the sale of goods, but our health needs a different value system than profits. Anyway, that was my view.
Thank you. I'll ask for some more questions now, but just before I do, we've located the other questions that we didn't have earlier. So let me just tell you what those are so that we don't wander too far into that territory as well. The sixth area, which hopefully we'll get to, is to do with future staffing levels in the NHS. The seventh is to do with consultation with staff. The eighth is to do with party policies and candidates' views. And we have some miscellaneous questions which we may get on to or not. Okay, so still on the Health and Social Care 2012 Act. Any other comments from the audience, please? Yes. No, sorry, I'm pointing to the chap down here, 3 rows back. I'll come to you later if you've got time.
Good evening, Martin Rutter. I was surprised to hear, Patrick, you saying that the repeal of the Health and Social Care Act would have consequences because of the role that the local authorities are playing, and you suggested that money had been provided for that. How do you square that with £157 million worth of cuts to Derbyshire County Council?
Well, again, we'll take those as rhetorical questions. I know it might be rather frustrating to have questions which I'm not going to allow people to respond to. But again, as we said earlier, maybe those responses can be worked into answers to later questions. Thank you. There's a chap near the back.
Just a brief comment. Given the recent revelations from Rotherham and other institutions in the public sector, we need to be very careful about ideology. It's perfectly clear that the public sector is no panacea either. 1,500 abuses in Rotherham.
Thank you. Any other comments on this question, please? Leslie.
I just want to correct something about staffing levels that Mr. McLoughlin mentioned there being more nurses and doctors. That doesn't seem to apply to general practice, where there's a shortfall of 1,000 general practitioners that trusts are and other bodies are looking abroad to try and recruit GPs, since the training schemes are not producing the number of GPs that are required. And over a period from 2003 to 2015, the numbers of district nurses have reduced from 12,500 to 5,500. And this government is asking the community health services to take over the majority of care, particularly of the elderly. I just don't see this happening.
Thank you. Okay, we'll move on now to a second question. Goodness me.
Can you all just shout?
No, I can't shout.
We'll move on to our second question, which is from Hilary Fender, and the question is, does your party intend to reject TTIP? TTIP, I always get this wrong, Transatlantic Trade and Investment Partnership. As I ask candidates to reply, perhaps I would also ask them, as part of their answer at the beginning, to say what they understand the TTIP to be. So hopefully we'll all record on that, but we'll get an explanation from the four candidates of the nature of this. The question then is, does your party intend to reject it? So going in reverse order at this time, I'm still asking people to give them their 3 minutes. I'll go to Ian Wood.
Last week, Canada, the Canadian government, was sued by a mining company called Bilcon, who wanted to burrow into very environmentally sensitive wastelands in northern Canada in order to mine basalt, which is a rare mineral, or rarish mineral. And the Canadian government decided that Bilcon should not be allowed to do it because the area that they were going to mine was a important area for the breeding cycle of a rare whale. And as a democratically elected government, the Canadian government, I think, is fully entitled to decide that the interests of a rare whale should take precedence over a mining company's desire to exploit a basalt resource. Bilcon used TTIP because Canada has an agreement with America of the same kind that is being proposed for us under TTIP. And I have to say that the most pernicious aspect of the TTIP treaty is the way that disputes are settled. It's called investor-state dispute settlement. And that means that companies can sue states, but states cannot sue companies. And whether or not companies win, the states have to pay all of the costs. So this is a bit of a one-way deal. Let me tell you further that the judges in these tribunals are commercial lawyers who are normally retained by the very rich companies who are using the TTIP process. So again, a bit of a one-way deal. And needless to say, the ISDS panel decided that Bilcon should be allowed to mine for basalt. That is an extended example in the very recent past. Let me give you 2 or 3 scare stories, which I suspect are more realistic than scare. Mr. McLoughlin will know that if we get TTIP, then regardless of what he wants to do with the railways, TTIP could be used to stop him doing it. And more dangerously, if the Green Party takes power in a few weeks, and we wanted to renationalise the railways, which we do, we might be stopped from doing it under the TTIP provisions. TTIP could be used to lift controls on genetically modified organisms, so that's not seeds, that's living things. And if we wanted to deal with banking regulation and make the banks more robust, that could be second-guessed. There is a petition going round, which the Liberals have signed, and I think the Labour Party too, which wants to keep the NHS out of TTIP. Well, that would be a futile thing to do, because these multinational drug companies exercise huge commercial leverage and would just wheedle their way round out of being left out of TTIP. But it also suggests that TTIP without the NHS in it is fine. And my message to you on this is that TTIP is not fine, with or without the NHS. It's worse with. Without it, it's still TTIP, and it's still objectionable. We would never have it.
Thank you. Patrick.
Well, first and foremost, TTIP, which was part of our question, our understanding of it is a free trade deal being negotiated between the United States and the European Union. So that's what it is. Is it necessary? Yes, I think it is, because we rely on trade between our nations, and there are certain obstacles which exist which cost us money. And one of the examples where we could look to save money, because one of the things that we do need to have better cooperation on and understanding of is the whole pharmaceutical industry. We've just been talking about National Health Service. That was the last question. One of the things that has led to some of the major advances that we've seen in the National Health Service and in health recovery in this country is the research and development that's gone on by the pharmaceutical companies. By the way, most of them in the private sector, and most of them operating at a profit. But also with that profit, they're investing in finding new drugs and new research, and actually having a better understanding and about breaking down some of the barriers between some of the regulation units of pharmaceutical companies. I think that works in our favour, and TTIPs will decrease the regulatory duplication, thus making drugs cheaper for us to be able to buy. And it's all very well my Green colleague saying that somehow I'd be prevented from doing certain things as Secretary of State for Transport because of our membership of TTIP. Well, unfortunately, we're not joined by UKIP tonight for some reason, but we could be directed from not doing various things by us being members of the European Union. Overall, I think we're better off for our membership of the European Union. There are occasions when it drives me crazy, but overall as a country, I think we're better off, but we should have that debate, and we will have that debate, I'm sure. And it is the European Union that is negotiating, so I don't know if it's green policy now also to pull out of the European Union as well. Oh, it's not. Oh, well, it's actually the European Union that's negotiating this deal. So if you're inside the European Union, then I'm afraid you're going to have to go along with TTIP.
The European Union should be a lot better.
Look, I didn't interrupt you. You know, just
I'm sorry.
Let me have my say. So that is the point as to what it's all about, and why I think it is necessary for us to see TTIP. But it has to be openly negotiated. It has to be more fuller. But you can't put all your negotiations out in the public domain. But there are two select committees which have been monitoring this very closely in the House of Commons. There's been several debates on it. And there will be continued to be debates, but it will take some time before we actually reach, or there is any reaching agreement. These negotiations have already gone on for some time.
Thank you. I'll ask Ben now to respond to the question, which was, does your party intend to reject the TTIP?
No, in one word. I did sign that pledge today to keep the NHS out of TTIP, but I think it can be beneficial to our economy. It's a multi-billion-pound deal between the EU and the US, and we should look at the positives as well. And also, I'm surprised no one's mentioned yet, I don't know if everyone's familiar with this, the leaked document in the BBC regarding the negotiation. And it said this: the EU reserves the right to adopt or maintain any measure with regard to the provision of all health services which receive public funding or state support in any form. So we do have that protection for the NHS. And the ISDS component, which Ian mentioned, has been removed from negotiations at the moment. Free trade is a good thing, and yes, it has to be monitored. We have to make sure that things aren't swept under the carpet. What we can't go down is the protectionist route. We've seen what happened during the Great Depression in America and worldwide, how a protectionist approach just doesn't work at all. And I have to say as well, I know Green Party policy is also to have a zero growth economy. Now, I don't believe in a invisible hand of capitalism approach. I don't think we should just blindly trust the markets. I do want to see an active role from the government in the economy. But growth, when delivered correctly, is a good thing. It raises our incomes, it allows increased public spending. So we can't have a protectionist approach, and we can't have a zero growth economy. It just doesn't make sense at all economically.
Finally, does your party intend to reject the TTIP? Andy?
I can't see how the Labour Party cannot reject TTIP. The Labour Party have been quite clear on the involvement of TTIP in the National Health Service. The Labour Party have been quite clear on the fact that they want to bid to bring the rail industry back onto public ownership. TTIP would not allow that to happen. TTIP allows companies to sue governments, as has just been said there, for restricting competition. The Labour Party are quite clear that they intend to bring the railways back under public control. They are quite clear they are going to repeal the 1993 Rail Act and start bidding for the rail industry so that the rail industry is run for the good of the people and not for the profit of the millionaires. The Labour Party are quite clear that they intend the National Health Service to be run for the good of the people and not for Richard Branson and Virgin Healthcare and the tax avoiders who've got their companies registered in the Virgin Isles, in the Cayman Islands, who are avoiding tax. The Labour Party are quite clear that they will protect education. The Labour Party are quite clear they will protect services like the police and the fire, that they can't do if TTIP takes place. And if TTIP is such a good thing, why is it being negotiated behind closed doors? If it's such a good thing, why aren't we having open negotiations? And once again, are we not sat here on the cusp of a general election with two parties not telling you what they're buying into? Are we not sat here once again with us not knowing what we're voting for? And that is not fair. Read the policies. Read the policies quite clear. We are not for big business, but we're not against big business. We are for big society. That's what we're for. We are for looking after the people in society. And I'll throw another story in here. The Australian government being sued for having plain packaging on tobacco products because it's restrictive to business. It opens up the same as if we have living wage, minimum wage, we have different paternity rights, we have different workers' rights in this country. It could be considered as restrictive practices for companies in this country competing within Europe and with America. And we could be sued for it. It's time we had a way forward in this country and decided what we want for our companies and what we want for our workers. And if it is so open, tell us now, Patrick. You've told us just that, and I think this is a time where we can have a question to another member of the panel. You've said there are panels, there are committees who know what's being discussed. Well, I'm sure there's over 100 people here who would like to know what's being discussed under TTIP.
I'm going to stick with the principle of not asking people to answer questions. I think we know that rhetorical questions make strong points and people will respond to them or not, and people in the audience will make their judgments on both the nature of the questions asked and
well, can I just say that, because, the point is, as I said, this is not something which is being negotiated government to government. This is something which is being negotiated by the EU. And the Commission have consulted publicly on its negotiating priorities and investment protection, holds regular meetings with the public and has published 11 position papers with the detailed information about the negotiations. So when I say they're being as open, obviously there are negotiations going on. And one of the things you don't do in negotiations is put everything in the public domain. But they have published their position papers as to the route they're taking. And this is not something which the British government's doing. This is something which is done by the Commission. And, Andy, the Labour Party aren't even committed to a referendum of our future membership of the European Union. We are.
Thank you. Thank you. We won't normally have responses to rhetorical questions. However, enticingly, they dangle the bait. The question came from Hilary Fender, and I'm going to take it back to the audience now, starting with Hilary. Where's Hilary, please? Right over at the back there, please. 2 minutes, Hilary, maximum, please.
Is that better? Yes. I was a nurse, midwife and health visitor in the National Health Service for 30 years. I'm sitting here listening to all this business talk of profit, which to me, and I suspect to many people here, is difficult to really put in the same paragraph, sentence or phrase as the health service. And my personal feeling is that profit and business worlds, as far as possible, need to be kept separate from the health service in terms of this, what we're talking about, the TTIP. It's interesting we have a lawyer on the panel because I think many of us believe that the NHS is and has been, in many ways, the envy of the world. And my limited experience of the United States Health Service, which is really much more this free trade model, I think, that we're hearing about, is that that's not a route we want to go down. So, although this is obviously a really big and very complex issue at European level, it's something I think we're going to have to get our heads round to understand and to cast our votes accordingly in the coming election. Thank you.
Any other comments, please? Yes, there's a hand on it back there. And there's a microphone coming.
Okay, I would like to make a lot of money. I think trade is a good thing. But I don't think we should have trade at the expense of the vulnerable, which is a real concern, I think, shared by a lot of people in this room. And I especially don't think there should be free trade at the expense of democracy, which I think is another concern. And I share the reservations of some of these panellists, and I think Patrick should have them too, because if this agreement is passed, what is the point for you?
Sorry, what
is the point of having a democratically elected government if this agreement is passed?
I agree. Other comments, please, on TTIP? Yes.
A bit left to that. I would say that if anyone is genuinely concerned about it being done behind closed doors, you could go on the Commission website, European Parliament website. Every day that there is a negotiation to do with an aspect of TTIP, they publish a summary of what's going on, and they also publish an agenda of things that will be discussed in future TTIP meetings. So if people are genuinely concerned about it, they can follow it there, and they can have an active input through the European Union's social media channels, or I don't know, you could even petition whoever the UKIP representative for the East Midlands are. Or not. They probably don't even turn up, but there we go.
Thank you. I'll take one more if there is one. Yes. Is that Bob Rhodes?
Yes. The only argument in favour of TTIP that we heard from the two people who were in favour that I heard was that there would be a good regulatory framework, a framework which was...
Well, could you hold the microphone a little further away, please? You're rather blurred. And could you repeat that? I didn't catch it, maybe just in my hearing.
Right. The only argument that we heard for the TTIP was that there would be a smooth regulatory framework, which would be, I think, a race to the bottom. We saw what happened when we had a loose regulatory framework with the banks 6 years ago, and but not something similar happen with this.
Okay, thank you. I'm going to move us on to our third question now, and who knows, some of these issues may come back. The third question is it concerns social care. It's from Chris Thompson, and it says, how would the candidates address the shortfall in social care caused by cuts in local authority funding? I think we did just touch this earlier on. We're dealing with that question now specifically. How would the candidates address the shortfall in social care caused by cuts in local authority funding? I'll ask Patrick to go first on this one, please.
One of the things that we had to wrestle with when we first came into government was the huge deficit the country had. Now, we may not like the idea that we've got to try and get living within our means, but actually I think it is quite important. We've cut the deficit basically by half, but we've still got a huge deficit that we inherited. Now, all parties accept the need to address that deficit. There's two ways you can address the deficit. You get growth into the economy, which I hope we will do, and you can also cut spending. I've got to tell you as a politician, one of the hardest things to do is cut spending. The easiest thing in the world is to spend more. It's the easiest thing in the world. And the only way we can spend more is either taking more off you or increasing the deficit. If we increase the deficit, we're just passing the debts on to our children and their children. So actually, that is the task that we've set ourselves with. And sometimes that means making difficult choices. But I also have the view that we've got to concentrate on front-end services. And part of the provision that we've done, as far as the health service is concerned, we've increased the spending on the health service over this Parliament by over £12 billion, which was more than what we would have needed to have done if we'd just done it as far as inflation is concerned. It's huge money, it's vast amounts of money, it's money beyond sort of understanding almost. 112 billion doesn't sound very much. It's £112,000 million a year that we're spending on the health service right across the system. And on top of that, there is the money that goes to local authorities and how they organise their social care. So that's the way we've got to do it. We've got to look at imaginative ways, and we've got to be very open about the big challenges that we face, and I think we have been.
Thank you. And I'll turn to Ben now to reply to the question: how will candidates address the shortfall in social care caused by cuts in local authority funding?
By providing more funding. The NHS Chief Executive, Simon Stevens, he said that by 2020 the NHS will need an extra £8 billion a year. Liberal Democrats have committed to that. But of course we have to make sure we find ways to get that money and not just, again, increase the deficit. So we want to cap pensions tax relief for the richest pensioners, align dividend tax with income tax for those earning over £150,000 a year. But crucially, we can't just supply more money, we have to look at how that money is spent to make sure it's concentrated in the right areas. But also, we have to make sure we continue that pledge to spending, which, incidentally, Labour Party did not commit to in 2010. They committed to cut the health service. And the NHS in Wales, which is run by the Labour Party, has cut the health service spending by 8.6%. And they haven't met A&E targets since 2008. So, going back to the question, we have to make sure we provide that money. We put our money where our mouth is, meet that commitment by Simon Stevens to get an extra £8 billion a year by 2020. We have to make sure it's properly funded and make sure we concentrate it in the right areas.
And now I'll ask Ian, please, to respond to the question.
The question was about social care, and we see a huge role for social care, especially in the care and health of the elderly, because, of course, the reason why A&E departments and hospitals are under such pressure is because a lot of elderly and vulnerable and frightened people are going to hospital because they're not being looked after in their communities. We would, in fact, and it seems a very large number, and it is, we would actually recruit 400,000 new social carers to take the pressure off the other parts of the NHS. And we would do that in the expectation that there would be a quid pro quo. In other words, it would cost us a lot of money, but we would save quite a bit as well. And where would we get the money from? Well, the initial increase in the NHS budget that we would introduce would be 12 billion. It's 12 billion on top of what the government now is giving. And we would pay for it by higher taxes on the rich, much higher taxes. There would be a wealth tax. So the top 1%, the very elite rich, the billionaires, would pay 2% wealth tax on all of their assets. That would raise a very considerable amount of money. We think 35 billion over 5 years. And we would have higher taxes on fuel, flying, aviation would cost quite a bit more. on land value, not on buildings, but on what you could actually get by renting out a building that you built on the specific plot. That would affect, obviously, larger plots that tend to be owned by the wealthy. And we would have contributory taxation on alcohol and tobacco. Every unit of alcohol would cost 50p. So for wine drinkers like me, that would mean that you couldn't get a bottle of wine for less than £6. I would expect, actually, that beer and the lager would be relatively unaffected. Social care is key to a holistic National Health Service, and one of my major objections to what the government has been doing is that it is not holistic in its approach to our valued public service.
Finally on this one.
Thank you, Chair. I think the question was regarding social care, and it was on about local funding. And as you know, because I keep saying it a lot, the local funding to Derbyshire County Council has been cut by £157 million by this coalition government. And those cuts to funding does have a cut to care. And I'm sick to death of hearing this. You left us in a mess and we've got to cut it, and we've cut the deficit by half. Yes, Patrick and Ben, you've cut the deficit by half, but you've also sold off the Royal Mail and Eurostar to start digging into that. Not by making cuts. It's no good me going home to my family tomorrow and saying I want to pay the mortgage off next year, so we're not going to eat and we're going to freeze to death in the meantime, because that's what your government is doing. We've had a deficit in this country since the turn of the century. Why suddenly are we trying to pay the deficit off in one term of government? Or 2 terms of government?
Let's ignore the deficit completely.
We have said we will work within a budget, and we will pay the deficit off when we're able to do. And yes, I do want to ignore it, Ben, if it means that I'm putting people into food banks. I do want to ignore it if it means I'm leaving people in rural poverty and rural isolation. Yes, I do want to ignore it if it means that I am making people so they go into the NHS much quicker than they need to because we can't provide social care. Yes, I do want to ignore it if it means I've got to cut bus services and I've got to cut childcare and I've got to cut Sure Start. Yes, I do want to ignore the deficit.
New Labour failed in all these aspects.
I will deal with the deficit, and we've costed the deficit. What we will do is we will reintroduce the higher rate of tax for the millionaires that your government cut within days of coming in. We will provide 20,000 more nurses, 8,000 GPs, 3,000 midwives and 5,000 home care workers. This will be paid for by a £2.5 billion time to care fund, using a tax on mansion tax and a tax on tobacco companies. And we are the only party who are prepared to take that to the Office of Budget Responsibility to show that that is costed. We are not here to hurt the people who we represent. We're not here to hurt the people who elect us to go to government. And the people who have not been hurt under this is the millionaires who are avoiding tax. The friends of government. The people who refuse to pay tax. Make the people earning the money, make the people who are running 0 hours contract warehouses who got paid £2.5 million to build their sports factory within this county, who have people giving birth in their toilets because they daren't take time off because they're on 0 hours contracts, make them pay tax. Make them pay people a living wage that then also pays tax. That's what the Labour Party will do, and that's not this government. The coalition government, have not done.
Okay, I'll come back to Chris Thompson, who's asked the question, and ask for your reply, please, Chris. I don't know.
The reason I asked the question, like a lot of people, over the Christmas and New Year period, I was disturbed by the horror stories coming out of A&E departments up and down the country, which were over full of patients, people lying in corridors, not getting treatment in time, and it became obvious that the main reason for this was that the social care structures that were there to take people away from hospitals so they could be cared for at home or in their community were no longer there. The reason they were no longer there is because of the level of funding cuts to local authorities, and Patrick himself admitted that this was a difficult decision that had to be made. I don't share that view, which is why I asked the question. The worry to me, I have to say that for me, as a citizen of this country, the creation of the NHS in the last century was the social achievement that I am most proud of being a citizen of this country. And the principle that a civilised society should pay for the healthcare of all its citizens, irrespective of their means to pay for it, for me is a given. It is a sign of a civilised society. The danger is you cut social care, you squeeze the NHS, the blame comes down on the NHS, and therefore that opens the door to unnecessary reorganisation, which is for the benefit of profiteers. And this, to me, is trampling over my rights as a citizen of this country. I'll just say one more thing. We are the 5th richest nation on the planet. We have food banks, we have people on minimum wages, we have tax avoidance at a level which is shameful. If we want to have a health service for all our citizens, it brought me into the world, it brought my children into the world, it cared for my parents in their dying days, and it's something I value enormously. If we, as the 5th richest nation in the world, cannot pay for the health of our citizens, all our citizens, then I would be ashamed to be a member of this country. Thank you.
Thank you. Just to remind, thank you, Chris, to remind people of the question, how would candidates address the shortfall in social care caused by cuts in local authority funding? And to chap here with his hand up, please. Microphone here, please.
Hello. I must say it's a shame that there are, I don't wish to be derogatory to anybody here, but the average age is probably quite high in the room today. It's a shame there aren't more under 50s and under 40s here, and I include myself in the over 40s. Particularly because I'm going to follow on from what Andy said. He wouldn't put in such terms, but I will. The speech that Andy just made, however dramatically well-intentioned and vehemently put, pretty much ended up to saying that what the Labour Party intends to do is do what it's done before, but more so, which is spend money that you can only spend once, in the very short term, and pass on the bills to the younger people in our society, to the children and the grandchildren, and hope that somehow we will be able to pay for them in the future, while at the moment having no idea how it's going to happen. You can only ignore the bills for so long, you can only spend money once. I want to see the NHS funded sustainably, and that has to mean having that funded within the context of a sustainable budget. Andy Botham and the Labour Party appear to be dead set against that. I'm flabbergasted. I'm quite appalled.
Thank you. Could I just make a general comment, please? When using the microphone from the audience, can you just make sure you keep it a reasonable distance away? Otherwise, what you're saying is muffled, and we can't make it all out. So if when you start speaking, you have a look at me, I'll indicate whether it's all right or not. Thank you. More comments, please. Yes.
Hi. I just wanted to check with Ben if Nick Clegg was going to sign a public, whatever he signed before, about not raising student tuition fees in terms of the NHS.
Well, we're taking these as rhetorical questions. We understand that we make our points through questions. So I won't ask people to reply because the nature of the meeting is we're going to do it this way. There's a person next to you, and then there's somebody with their hand up at the back. I'll take the person here first, please.
I just think that one way of getting more money to spend on the NHS would be to put a cap on enormous rents, rather than putting a cap on housing benefit, but paying those enormous rents.
Yeah. Thank you.
Sound very naive, possibly very unpopular. But lot about companies avoiding tax and wealth tax. I'm not saying that I think obviously companies shouldn't avoid tax. Wealth tax is not necessarily a bad idea. But since we're all so terribly committed to the NHS, which I think probably we all are, and it's for every single person in this country, I just wonder why it is that almost no party has the courage to suggest that everybody in this country who is a taxpayer should pay just a little more. How much would it actually hurt most of us if another penny or two was put on the basic rate? And how much difference would that make? I don't know what the numbers are, but I do know that it's a very long time since everybody in politics had the guts to suggest it.
Okay, I'm not going to take any more questions on this one. Sorry if people have got their hands up. I'm going to move on to the next one. We're just over halfway through our time. We are going to finish definitely by 9:30 tonight. Can I just commend everybody at this halfway mark on the panel and also in the audience to keeping to time and not introducing interruptions. So well done everybody. It's enabling us to get through the agenda. We're going to go on to question 4. This has been classified as within the area of privatisation, and the question comes from Robert Baird, and it's this. The cost of the NHS is 60% less per capita than the USA's healthcare system. The Health and Social Care Act has made it inevitable that NHS services will be increasingly put out to tender. Considering failed contracts such as Hitchinbrook Hospital and the misreporting and billing of contract data by a number of private providers, is the NHS the right place to encourage the private sector to make profits? So that's Rob's question, and I'll ask Ben to go first on that one, please.
No, it absolutely shouldn't. And the NHS is vital that it always remains free of the point of use. But I have to reiterate the point I made earlier on. And don't get me wrong, I hate the thought of the markets or privatisation creeping in further into the health service. But it's not a new phenomenon. Even Aaron Bevan in 1948 said that the doctors who resisted the health service, I stuffed their mouths with gold. There's always been that private element. And when we look at the challenges of the NHS, it can't just be reduced to the private sector question. It's not just as black and white as the NHS is going to be free or it's going to be privatised. It's not simply that black and white. So we have to make sure we control privatisation, make sure it doesn't take over completely. I have to say, in all honesty, providing the NHS remains free of point of use and people are seen to, if a private element, a small private element, can reduce waiting times and increase care, then that's not an overall bad thing. We have to focus on the quality of care. We can't just reduce it to the private sector question. It's not simply as black and white as that.
Thank you, Ben. And Andy, next, please.
No, privatisation should have no place in the NHS. Businesses and directors of companies have a responsibility and a legal responsibility to create a profit for the shareholders. And whilst ever there's a profit coming out of the NHS to go to shareholders, that is money that is not being spent within the NHS that it should be spent for, which is caring for the people of our society. On about cutting waiting times, Ben mentions, well, from what I see, waiting times have flown through the window. The average waiting time in A&E, over 4 hours, has gone up under this government and since the Social Care Act came in. The time to see a GP has gone up since the Social Care Act came in. And the amount of companies coming into health and cherry picking, and this is the important bit, they will come and they will cherry pick the profitable parts. They will pick off the hip operations now that have been developed and are quicker and easier to do. They'll pick off the knee operations that are quicker and easier to do now, but they won't be going into the areas that we need them to go into. I've got figures here now that say 106 companies have been licensed to provide NHS community services. 358 number of GP surgeries run by Virgin Care. Serco has won £140 million worth of contracts within the NHS. This is all money coming out of the NHS, and I know this because I, and Patrick might back me up here, I've worked in the railway since it was privatised. I've seen the price of train travel go up. I've seen companies taking millions and millions of pounds out of the railway. And what will happen once they've bled our National Health Service dry? We're not going to step over people in the street dying in the street, we will still have to provide health and social care for them. So then the government will have to step in after the companies have walked away, once they've finished taking all the profit out of it, and the taxpayers will have to pay twice as much to rebuild it again. And it was my party, and I'm very proud of the fact it was my party that created the National Health Service, and it will be my party that will protect the National Health Service, and it will be free at the point of entry and free properly. We're not talking here that they're going to be charging you to go in, Ben. That's not the point we're making. The point we're making, it has to be there available to you. It's not there available to you when you're waiting 4 days to see a doctor. We will guarantee a doctor's appointment within 48 hours. We will guarantee cancer patients see a consultant within 4 weeks. We will go back to what we did under the last Labour government and rebuild hospitals, rebuild the faith in the National Health Service, because we own it, we gave birth to it, and we believe in it.
It's amazing what 5 years of opposition can do.
It does.
Gordon Brown and Andy Burnham, you may remember, Andy Burnham was the Secretary of State for Health of the last Labour government, so was responsible for what the Labour Party said in its 2010 manifesto. And it said, an active role for the independent sector, working alongside the NHS in the provision of care, particularly where they bring innovation. Actually, over the last 18 years, the biggest percentage of increase of using the private sector in the NHS was done by those two radical left-wing politicians, Tony Blair and Gordon Brown. So I'm not going to take any lectures, Andy, about this sort of great renaissance that was there, because when you were in office, and you keep trying to get me onto the railways, I'd be more than happy to debate the railways with you and to what's that? No, but Andy kept talking about it in his response there. I'm just saying that I'd be more than happy to debate that at some other stage. But, you know, I am committed to the health service. My family uses the health service. It has done a great deal for me. David Cameron, as Prime Minister, has had more cause than any other recent Prime Minister to see the health service and to use the health service and know what brilliant care it gave for his child. And anybody who talks to David and Samantha, as I have done on occasions, will know their love and admiration for the people who work in it. But it's no good trying to take a soft-edged sword that you can just... Instant extra money is the only way that you get improvements. We just talked about the drug companies. The drug companies are the private sector. Are we going to stop buying all these drugs, Andy? We're going to start making a nationalised drug investment centre? Well, some people may say yes, but actually we've had great development in drugs from the private sector. And sometimes we've had to take risks about the way in which we've used drugs, like the nurse that has just been treated today on a drug that was a brand new drug and had been out in Sierra Leone, who'd been out in Sierra Leone and caught Ebola and was brought back to this country and has publicly said today what the treatment that she got. So, as I say, it is the private sector, the use of the private sector in the NHS is small. It will remain small. Macmillan nurses are the private sector. Some of the charities are the private sector. They get classed in with the private sector 6% that we're talking about. Yes, they do.
Audience, come on, please.
Yes, they do.
Thank you, Patrick. Okay, and Ian, please.
David and Samantha Cameron do indeed owe a big debt to the NHS. But I always remember David Cameron is actually the public face of the hedge fund industry. And if the hedge fund industry really wanted the NHS to collapse, David Cameron would allow it to, and he would take private medical insurance and get all the benefits of private medical health insurance while everybody else had an NHS that had collapsed.
No.
Let me take you back, if I may, to the 1980s, when Cecil Parkinson, who was the health secretary under Mrs. Thatcher.
No, he wasn't.
Cecil Parkinson was a cabinet minister.
Oh.
Sorry, you're correct.
Yeah.
Who was a cabinet minister under Mrs. Thatcher, told a newspaper that it was not the intention of the Conservative government to privatise the NHS, but in a candid admission, he said that if he was, or if they were, going to privatise the NHS, then all the things that were being done would be necessary prerequisites for privatisation to take place. I look at what has happened in the last 30 years, and I could give you a long list of things that it would be necessary to do if you were going to privatise the NHS that have now actually been done. And surely when you look at the palaver that is taking place in Manchester, where already the Orwellian-sounding new care models are to be trialled under, it has to be said, a Labour administration in Manchester. And when you look at the... Yes, this is what George Osborne's doing with the Labour leader of the Manchester Authority.
Are you against that?
I'm in favour of a holistic NHS, and a fragmented Mancunian NHS is not part of a holistic NHS where everybody gets the same treatment wherever they are. The Nuffield Trust has now reported that more than half of all NHS managers believe that in 10 years' time, more things from the NHS will be charged for than now. And all of this guff about free at the point of use, there's hardly anything that's free at the point of use if you want to go off-piste and not have a frontline service, but want to do something slightly more obscure. I mean, you notice that they lopped off the opticians and the dentists a long time ago. I remember David Muller was defending the dentists because he said, well, it was hard to foresee and that he didn't see it coming, even though everybody else had told him that it would come. Free at the point of use is already a very greatly eroded principle, as anybody who has to pay for drugs from the chemists will know. The Green Party would return the NHS to public ownership, full public ownership, would rid it of the pestilence of private money and take away the purchaser-provider partnership, which is destroying the NHS from within.
Okay, we'll take that question to the audience now. Let me just praise it, just remind you. It starts by saying the cost of the NHS is 60% less per capita than the USA's healthcare system. It talks about failed contracts, misreporting, etc. And then it says, concludes, is the NHS the right place to encourage the private sector to make profits? Rob, you asked the question.
Thank you. The Labour Party's hands, unfortunately, aren't particularly clean in terms of discussing the use of the private sector. I worked in the NHS at the time, and I think predominantly it was an attempt to try to reduce waiting lists, which I think you did spectacularly well. However, it does make it difficult for you to start to put the argument forward that we're heading down the wrong track. I think the Health and Social Care Act is a completely different animal. The way it is written, tendering and increasing privatisation or marketisation of the health service is a self-fulfilling prophecy. And the government can sit back, fold its arms, and just let it happen. And you can actually then say, we're not making the decision, it's the NHS who are. But the way the Act is written, it is an insidious act, and it will force increased privatisation. You keep saying that 6% is now privatised, if I may use that expression. If you look and break down the figures, 6% of total NHS spend, there's nowhere near do justice to the amount by which it is currently privatised. If you look at community health services, over 13% was in non-NHS hands, and that was over 2 years ago. And the way, if you look at the press now, the pace at which it is going, it could well be over 15% and heading for 20%. This is not a small issue. If you look at the consequences, all you've got to do is look at home care, which is largely privatised now. I have a niece who works in home care. She's lucky to get paid the minimum wage. She's not paid for travel. She's not paid for her travel time. The service she's working in is demoralised and poor quality. We've seen so many contracts that have been privatised, where the only way for them to work is for them to undercut the original NHS service which was provided at cost. If you undercut a service provided at cost, something has to give. It will be numbers of staff, it will be quality, it will come out, and it will show. And that is what is so wrong with it. Thank you.
And there's a hand up right near the back. I can't see what it's attached to. I can now.
I'm no politically leader of 25.
Sorry,
sorry. I would just like to say, the notice mentioned local issues. I found over the last 5 years considerably increased the care and the patients. When I've been to my own doctor, everything's improved. You know that in 5 years. I visited a doctor long ago. It wasn't very good in the first place 5 years ago, but during the last 4 years, it's improved. It's improved all the time. Yes, and generally locally, I've heard that the doctor's surgeries. You talk about taking a long time, but I've been perhaps about every 2 months, I should think, and it's gradually gone down from about an average of half an hour waiting. This is a McLoughlin surgery, and I can tell you the average is about 5 minutes, 10 minutes. So I think it might not be the case nationally, and I've been partial with politics, but locally there's been wonderful improvement.
Thank you very much. So we have a hand right in the very back row now.
Something that's not been really covered in this discussion is the true cost of privatisation. I've heard people say that they don't mind where they get their care from as long as it's good. My objection to private medicine is that, firstly, it fragments the health service. I first started working in the health service 51 years ago, and I'm a retired GP. It fragments the care of people. People with chronic conditions particularly need coordinated care. An example would be someone with diabetes, which can affect different systems, different organs. And the use of individual private companies dealing with each different system complicates matters and makes coordination of care very difficult and often dangerous. Secondly, the cost of private medicine is huge. When I first started working in the health service 51 years ago, the administration costs were 3%. 25 years later, it had risen to 5%. Then the internal market was introduced, and in the next 25 years, it went up to 15%. It is estimated that if this current government is re-elected and the privatisation continues, and it will accelerate, it is probable that the administration costs will go up to at least 20%, possibly 30%. The Commonwealth Fund latest report
described the publicly run NHS as the best and most cost-effective system in the world. The worst system of the 11 countries they looked at was the United States, and this is despite the fact that we spend 1/2 of the amount per capita that the United States does. The administration cost of healthcare in the United States is 36%. What people don't seem to realise is that getting your private care has involved a process which is hugely expensive. This tendering of contracts is putting lots of money into the pockets of competition lawyers, accountants, auditors, and so on. And this is not what people want their money to go towards. They want it in frontline care. Most of these companies do not pay tax in this country. They all have their bases in tax havens. Finally, private medicine is extremely unsafe. They often have poor equipment. They cut corners to try and make a profit. They cut staff. They have untrained staff. They have been found to be failures in many, many cases. Serco, which covered the out-of-hours care in Cornwall, had one GP on call for the whole weekend for the whole of Cornwall. They were only found out because whistleblowers blew the whistle, and when they were investigated, it was found that 252 instances of data falsification had taken place. Of the private companies that are now being used by the health service, many of them have proved failures. Circle failed with Hinchingbrooke Hospital, and they walked away from their contract. I could go on for much longer, but I won't. But I can tell you that private medicine is a very unsafe business, and if I have to have an operation or go into hospital for any reason, I would never ever choose a private hospital. Thank you.
I'll take one more on this question, please. The chap with his hand up here, please.
Ed Wilson. I'd like to thank the panel for their answers. There was only one answer I understood, and that was Andy Botham, who said no. However, I would like to thank the previous government for the development of Derby City Hospital, which I think is a fantastic achievement and something that this area can be really proud of. Tragically, I'm a bit worried about the costs. It was completed under private finance initiative. The total capital costs were 340 million. The repayments will be 2.5 billion. The institutional investment channel for this hospital was Innisfree. And looking them up on Wikipedia, that bastion of inaccuracy, I discovered that in 2010-2011, their profit margin was 53%. Those are the kind of deals that we signed up to get that fantastic hospital. I think it was a little bit over the top, and we were disappointed.
Thank you, everybody, for... sorry, Pat, do you have your hand up?
Mr. McLoughlin has made several references to the wonderful drug companies and the good job that they do. But we know that the drug companies are not doing this out of the goodness of their hearts. The drug companies make bigger profits than almost all other private companies. Is this what you want, a drug company which has developed a drug which will help to prevent meningitis, but there's a big argument going on with your government who won't pay the price that the drug company is asking?
I think that is a direct question. Rhetorical.
It is a rhetorical question. Well, it's not a rhetorical question. I'm going to allow a reply to that because it is a very topical issue now. But just a brief reply, please.
No, well, look, that's why we're trying to negotiate hard with them, because they are trying to get to a higher price. The point I was simply making is that, when you talk about privatisation, when you talk about the private sector, it is the drug companies that are doing that. No one is suggesting that we're going to not use them, or that we don't have some of the best drug companies doing immense research in the pharmaceutical industry, and we're actually quite one of the world leaders, and I want us to keep us that way as well, because it provides a lot of employment in this country. But that was the point I was making. But you're absolutely right, and that's why actually one of the things the last Labour government did, which we have kept, is to bring in the restrictive list, so that we can, after a certain period, sort of drive down the prices of various drug companies. I think that was eminently sensible, and it's something that's carried on.
Thank you. Okay, thank you everybody on that question. We're going to hurry on. We are getting through our questions here. The fifth question now is to do with issues of affordability. And for each question I've been reading out, there also is an envelope containing other questions of a similar nature that have come in. So if you thought you'd written a question earlier this evening or beforehand and it's not been read out, it'll be lurking in one of these envelopes under the cover of the question that has been read out. But this time, we've got two questions on this affordability that I've been given, so I'm going to read them both out. I've not read them yet myself, obviously, so I'm assuming that they are similar or interestingly contrasting. Roger Morton's is the first question. The basic budget for the NHS has been fixed at a money increase of 0.1% a year. However, there are at least two reasons why this is effectively a cut in funding. One, it doesn't take account of inflation, and two, the population has grown at a rate of 0.4% a year over the last 5 years, and is forecast by the ONS, Office of National Statistics, to do the same over the next 5. The combined effect is a shortfall of about 16% in the last 5 years, enough to explain the present sense of crisis. Here's the question. What can the parties be expected to do about this, and what do the candidates individually think should be done? Okay, so this is about a shortfall. And then the other question is from Bob Rhodes. We could afford a comprehensive free health service in the austere 1950s. Why not now? So we're putting both those questions together. And I'll ask Ian to kick off on this one, please.
Well, the reason why we can't afford an NHS now, we're told, is because of the need to reduce the current account deficit. That is not the real reason. The real reason why we cannot afford an NHS is because the Conservative and Liberal coalition will not decide that it deserves to be funded properly. And there is also, I suspect, a strain of Conservative thinking that says, wouldn't it be better if we had a smaller state that did less? That encourages people to stand on their own 2 feet and be more independent. That is a strain of Conservative thinking. A lot of people, especially on my end of the spectrum, believe that Conservatives are intent on creating a smaller state. I'm not so sure. I think the reason is even worse. The reason why they won't spend on a public good like the NHS is because they want to impose austerity because they're terrified of the bond yields going up. And this is where I drift over into economics. The fact is that we have a stunning amount of debt in this country. 1.5 trillion on the public register, 1.4 trillion going up again on the consumer credit register. That is a huge amount of money for a small country like ours to own. It wouldn't take very much for the money men to abandon the pound. And if the yield goes up, because they are doing that, the government goes bust because it can't afford its borrowing. I shall now stop talking about economics, but that is my view. My view is that we are in such a bad financial shape that austerity is necessary to reassure the very important Soroses and people like that who actually control the international economic system. Why can't we afford it now? Well, I think we could. The biggest part of the current account deficit is the trade deficit. If we built more schools, hospitals and houses, we would put more people to work and they would pay income tax. The reason why it's so difficult for this Conservative government to pay down the deficit is because they have been so lamentably unsuccessful in getting people to pay tax. They trumpet it. They say, isn't it marvellous that nobody's paying tax? But the quid pro quo for that is that we have to put up with austerity. Austerity hits the poor. The Conservatives are here to support the rich. And I'm afraid, in encapsulation, that is the truth of it.
There's a bit of me wants to respond to that, but I think I'll try and answer the question instead. Why can't we have the same health service that we have in 1950? Well, I think we're perhaps looking back to the 1950s with some rose-tinted glasses that never really existed as far as the 1950s. Now, I didn't get born until 1957, so I can't really account for the first bit. But the idea that somehow everything was fine, people were living a lot less, and the population was a heck of a lot smaller than it is today. So please don't give me back to the 1950s. No, I prefer the 2020s and the 2030s, 40s, 50s, and hopefully the 60s, but I might be a bit old by then. But hearing Michael Esseltine the other week saying that he wants to come back to the National Forest in 25 years' time and plant another tree when he's 82 at the moment, I think gives me encouragement. I think that is why the 1950s. We have substantially increased spending on the health service. We were told at the last general election when we made that pledge by Annie Burnham, we were making an unrealistic pledge. We've stuck to that pledge. The NHS budget has gone up by 12.7 in this Parliament. Now I can reel off, I've got them all here, 1.3 more million operations, 6.2 million more outpatients, 3.4 million diagnostic tests, 460,000, etc., 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 and it goes on 4 pages. That doesn't actually mean very much if we can't get the health service we want in our own locality by the people we want and the people we trust. And that's what we've got to do. That's what the whole thing about the National Health Service. And as I'm the first to praise the NHS as a great, great service, but I also don't see it with rose-tinted glasses. There are occasions where it has failed, where it has let people down. And that can happen in the private sector as well as it can happen in the public sector. Stafford Hospital was the public sector. It was a brand new hospital and it failed people. It failed people terribly and it shouldn't have done that. And it's only 25 miles away from, well, perhaps 30 miles away actually from Wirksworth. But it depends if you do it as a crow flies. But, you know, my son was born there and I know that hospital particularly well. So it is that kind of development we've got to do, and also in training and getting the right people in there and attracting the right people. And that is one of the tasks of any future government.
Thank you. Thank you, Patrick. And Andy.
Affordability. Is the NHS affordable? The NHS has got to be affordable. The banks were affordable. We wouldn't let the banks fail. We threw everything we got at the banks. Judges society on how it treats the people within its society. If you can't afford to look after, and we're on about people are living longer, that's something to celebrate. That's something to celebrate. And as we said earlier on, we're the 5th richest nation in the world. We shouldn't be penny pinching on healthcare and social care. 0.1%. That's not even allowing for wage increases within the National Health Service. That's not allowing for investment and innovation. It's because they don't want it to succeed. The issues that they want to succeed, they'll throw absolutely everything at it. You'll hear them talking about having to give tax breaks and not chasing tax off people because they don't want them to move abroad, because they want people to work in this country and they want people to generate income in this country. Well, they don't generate income. As we've just said, the problem in this country is, and the Bank of England is scratching their heads, how has employment been going up? But tax revenues have not been going up. That's because people are being employed on 0-hours contracts and they're not paying tax. That's because people are living below the living wage. People have not got the money coming into the government. As Ian's just said, the way to get this country growing is to build houses. We've pledged to build 200,000 houses a year. get employment moving, and from that taxation, and pay people a decent wage, and from that taxation, then you provide them with the healthcare they need when they need it. It shouldn't be a question whether it's affordable, it's got to be affordable. Government's affordable. If the House of Parliament was falling down, they'd soon find the money to rebuild that.
Well, it is, and we aren't.
The royal family are affordable. They find money to fund that. The bankers were affordable. They find money to fund that. Dropping bombs out of aeroplanes at £1 million a bomb. They find money to afford that. Let's find money to fund the National Health Service, how it should be funded, and treat the people who work within the National Health Service with some dignity, and stop telling them that they don't deserve a pay rise and they don't deserve a contract and they've got to work on 0 hours contracts. Let's do what we should be doing as politicians and looking after the people in this country who need it most.
Well, the first part of the question was how we meet the shortfall. And as I said earlier on, we're the only party to commit to the £8 billion a year extra needed by 2020. But whilst we're talking about shortfalls, something we haven't addressed tonight is mental health. There's a big shortfall in that as a priority and funding. There was some progress in the budget. Over the next 5 years, £1.25 billion will be spent helping 110,000 young children suffering with mental health. It's such a key issue. We're all affected by it, either through ourselves or through someone we know. Statistics show that as many as 1 in 4 people are affected by mental health. That's why my party wants to see £500 million a year allocated to specifically tackling mental health. Now, the second part of the question was about what will we do individually. And for me, I don't want to see the NHS politicised. I want what's best for the NHS, whoever's in power. If Labour get a majority, the Tories get a majority, I think they do well with the NHS. I'm not going to be sniping at every corner. And I wrote about this some time ago, and I've also tweeted about it on Facebook saying the NHS needs consensus, it doesn't need weaponry. And this comes to an approach which Andy's had over time, and he's shown tonight. It's an approach to politics which I fundamentally disagree with. It's a sort of poisonous tribalism which has poisoned politics over the years. And I'm sorry, the NHS, you said it wrong, we own it. The NHS belongs to the people, it does not belong to the Labour Party.
Okay, we're on issues of affordability. There were 2 questions, if you remember. The pithy second one was we could afford a comprehensive free health service in the austere 1950s, why not now? And that was from Bob Rhodes, who I'll ask. And first of all, Roger, you asked a more detailed and fact-inclusive question. Would you like to reply, please?
Thank you. Is that all right? Yes.
Yes.
I just I'll be very brief, but I just want to make 2 or 3 supplementary comments. One is that we, as we said earlier, we are a wealthy country by world standards. Sadly, we don't at the moment manage to feed and clothe every single member of our population. But we have the wealth to do so. But you would expect that whenever everybody has been fed, they would want to spend a relatively high proportion of the rest of their income, directly or through the taxation system, on things like education and health, which are central to the quality of life once they are fed and watered. The next point is simply that the language with which NHS funding is discussed is all too often glibly assuming that there are efficiency savings around. Efficiency savings should be the aim of every well-run organisation, and if you get 0.5% or 1% a year out of that, for any organisation, it's worth having. The problem with the NHS is that it's one of these organisations which delivers its service face to face with its customers. And you can't suddenly get in a robot. Well, maybe somebody's working on this for the NHS, but in general, you can't get in a robot to do the core functions of doctors and nurses. And therefore the language that efficiency services savings will be announced at a level of X%. Unfortunately, has the consequence is that if X is not reached, it actually becomes a cut. And I wish we could be honest about that. And I've gone on long enough.
Thank you. And I'll ask Bob to comment as well, please, as he had one of the questions here.
One of the issues that has been avoided by most of the candidates here and by the party leaders is the issue of tax. See, the issue of tax. We seem to be quite unable to suggest that people could pay more tax, particularly income tax, which is a progressive tax, and national insurance, which is also progressive. Both of those the party leaders have forsworn, and it seems to me that is a very dishonest attitude. If we don't have the political will to support social care, to support the health service, and that means the will to put up taxes where it is necessary. Obviously, there has to be control on that, and I think the last Labour government did not have sufficient control of the way it's spent in the health service, and used particularly private finance initiatives irresponsibly. But I look for and have not found any honesty about tax. For me, income tax and national insurance are the price we pay for belonging to a civilized society. And those are privilege for all of us.
Thank you. Here's your hand up, Jill. Yes, well, you can speak, yes?
Thank you. I think the answer to is the NHS affordable? Can we afford not to have an NHS? I don't think we can. The Commonwealth Fund, which is a US-based think tank, has found the NHS to be the most effective of health services in 11 developed countries, which includes France and Germany, Switzerland and the USA. It comes top in cost effectiveness. America, as we've mentioned before, comes, well, I don't know if we have mentioned it, it comes 11th out of those 11 countries. So if we're going to be following the American system of increasing private provision in the health service, we'll probably end up with a very inefficient and very costly system. Another point that's enough for now. Somebody else can carry on.
Okay, thank you.
There is an elephant. Can you hear this? There is an elephant in the room, and speaking as an elephant, I should speak up. Old persons, such as myself, would be a proper target of resentment by younger persons who will have to pay increasing amounts of money to keep me going when I didn't pay that amount that they are now going to have to pay when I was younger. I would say, as this particular elephant, it is unjust that the amount of money younger persons pay to me is subject to a triple lock, that I get paid more than the rate of inflation, or more than the rate of the rise in the cost of living, or more than 2.5%. A younger person would rightly resent that, and can this elephant say they are right?
So we're on the affordability issue still. Yes, this is the chap here. Yes.
Hello, my name's Peter. I'm a member of the Green Party, and I think I'd just make a general point. I think the Green Party have had quite a good evening tonight. They've had eloquent Ian espousing Green Party policies, and I've actually been quite encouraged because I think a lot of what Andy has said actually sounds a bit like the Green Party policies as well. So it actually bodes well for the Labour government that we hopefully will have after this election. So that's the first point. But on health specifically, the point that I want to make is obviously we talk about reorganisations and fundings and the health service specifically. But the more general point, of course, is that in order to have a healthy society, we need to have a more equal society. And the evidence suggests that the thing that will improve the health of society more than anything else will be greater equality.
Very nice. Well, you've had one go. I've just seen if there's anybody else. Sorry, there's somebody. Paul Webb.
Hello. I just want to reiterate that point that Bob made, and that is please do not patronise us. When you go back to your party organisations, recognise that people understand that health care is going to become much more expensive because we live longer and the medical techniques that are available are more expensive. So please recognise that we understand that it's going to cost. Please quantify that, and please be explicit about how that's going to be funded. No weasel words about whatever. Please, we understand we're sitting on a time bomb. It's going to cost. Please be clear how much and how that's going to be raised.
We've heard a lot this evening about the cost of the National Health Service, but what we haven't heard about is that we pay, with all the developed countries, one of the lowest percentage per capita with our GDP into the health service. So therefore, a lot of other money is being spent in other areas, and the health service itself is not grasping and grabbing all the money that the current administration would like to have us believe. And as Jill said, it delivers one of the best services in the world, and we've spent, percentage-wise, one of the lowest amounts of developed countries. Thank you.
Okay, now I'm conscious that we're coming near the end of our time, that it's just gone 20 past 9. I don't think we've got time for another question. It would just rush everything through too quickly. So I'm going to take one or two more comments from the audience if they are there. And then I think what I'm going to do is ask the people on the panel, one by one, just give them 1 minute to sum up this evening and their main message. So we have had quite a lot of time. I think that would be the best use of the time. But I can see Stella has her hand up.
Mine is just a comment that it would be very remiss of us all in this room if we didn't acknowledge how wonderful Harwich Brook Health Centre is. Yes. And we are so fortunate that despite all the problems they may be having at the moment, they've managed to look after us and treat us very, very well.
Have you spoken, Leslie? Yeah. Well, look, Moira's got her hand up. Moira, a quick comment, please, and then Leslie, a quick comment.
Just to add something, the Scandinavian countries tax more, and their lower and middle income earners have a higher standard of living than us, and they don't have food banks.
And Leslie, to finish with this.
Just a very quick comment about affordability. And I think that we should go back to the time before the purchaser-provider split, which Ian so well described for us.
Thank you. I think you're going to say something else.
Going back to the time before that split, where we were buying and selling within the health service itself, before there was much privatisation, if the numbers of lawyers and administrators was reduced, it would save a great deal of money in the NHS. And I just want to give you one thought, that if all the administrators in the NHS were to fall sick at the same time, there would not be enough NHS beds to accommodate them.
Okay, thank you. Thank you, everybody from the audience. I'm going to ask now the panel just to sum up one main message that they take bringing from their party about the NHS, and really just to keep it down to 1 minute, chaps, if that's possible. So it's just a chance to summarise. I'll start at this end. Andy?
Thank you, Chair. I think if I wanted to take one message away with you today, it'd be a message I've felt for a long time. You can't trust the market to provide services. The market looks after itself. Local state and national state should provide services and look after people. And the two don't work together because one has a very, very different need to the other. One needs to make money and the other one needs to look after people. And we see this in local government. I've seen it through the railways, I've seen it in health, we're seeing it in prison service, we're seeing it in the police service, we're seeing it everywhere. And as soon as you introduce somebody who wants to make a profit out of one of our services, there's only one way they're going to do that, and that is to drive down wages of the people who provide the services, drive down terms and conditions of the people who provide the services, and reduce the services. We need a firewall, and the firewall should be politicians, not businessmen.
Well, first and foremost, I'd like to thank you all for coming. I think this has been a great turnout on a Friday night, so congratulations and thank you all very much for coming. You've delivered strong messages tonight. I understand those strong messages. There's always going to be difficulty with the health service. It's always a question of should there be more money, should you put up taxation, and that has been the case time and time again. We are spending a huge amount of money on the health service. We will continue to spend a huge amount of money on the health service. With the developments in healthcare, but not only with the developments of healthcare, but the pressures that are now on the health service, with people living longer, I'm afraid more cases of things like dementia, which are becoming more prevalent because we're living longer and we need to provide that care. And that is always going to be a challenge for any politician of any description. I think Ben was right when he said, let's not weaponise the NHS. I think that was an evil word, and it showed an intent as to what to use the NHS for. I can assure you that I will always push for the services, for the National Health Service, and to make sure that the whole of the Derbyshire Dales gets access to those health services from the National Health Service. Thank you.
Yes, thank you all very much for coming. I've greatly enjoyed this evening, and I hope that it wasn't too painful for you as the audience. The one thing that I would like to emphasise at the end of this evening is to remind you, because I think you'll probably already know, that the policies of the Green Party are interlinked. Once you accept the logic of one aspect of Green Party philosophy, it's very hard not then to see the logic of all of them. And of course, the public generally thinks that the Green Party is worried about global warming, climate change, animals, and, well, that sort of thing. And we are. Of course we are. But the exploitation of the earth wouldn't happen if workers weren't being exploited. If debt wasn't being created, it wouldn't be necessary to have growth, which exploits the earth. The one is dependent, and we think balanced, by the other. And a need to fit the economy around the earth is the greatest problem and the greatest issue facing any government in any country. And I would suggest to you the greatest issue facing the whole of humanity.
Thank you, and I'll ask Ben to be our last speaker, please.
Do we have a balanced budget, or do we have a protected NHS, or actually, do we have both? We need to meet that £8 billion a year by 2020. We've set out that commitment. I've outlined tonight, and you've outlined as a party how we're going to afford that. But let's not forget the forgotten man and woman. Let's make sure mental health stays a priority. We have to remove this stigma. It's not visible most of the time. There's so many tragic examples of Gary Speed. It's not a visible thing to look at. We have to make sure we provide that funding, allocate those resources to mental health. But also, let's not politicise the NHS. Let's not do it down, but then look at the roads into classes. The NHS doesn't belong to the Labour Party, it doesn't belong to the Conservatives, the Lib Dem, the Green Party. It belongs to the people. It belongs to all of you here in this audience. Hold us to account. Let's work together for that. Let's have a better NHS. It's an NHS consensus, not a weaponry.
I was just going to say, could we please say thank you to the chair and thank you to the organisers tonight.
Yeah.
Thank you very much for your
Just before Jill closes the meeting down, I'd like to say, from my position on the chair, I'd like to thank people for being such a disciplined and participating audience. I had a feeling possibly I was going to have to control 2 or 3 speakers who were going to try and hog the meeting from the floor. And in fact, what a wonderful reflection on democracy here that so many people participated in this discussion. So thank you. And thank you for being very orderly. I did wake up at 2 o'clock this morning thinking, what am I going to do if somebody refuses to shut up and carries on shouting out, and did sort of rehearse how in a dignified way I could manhandle somebody out through the door and down the stairs. So thank you for being far exceeding my expectations in that respect. I will just say thank you to the organisers of this meeting, because I came in here at 4 o'clock this afternoon to make sure that I had a big enough and important enough chair on this platform. And they were working away then. These questions, they were processing questions at 4 o'clock. I don't know whether you stopped for tea or not, or whether this is... So, you know, behind the scenes here, people have been working away all the technical things and all the rest of it. A lot of work has gone into making this meeting happen, and a lot of it is invisible, but I have managed to glimpse what's gone into this, so I would like to thank the organisers for this. I'd like to finally also include the candidates in my thanks, that I didn't have to manhandle any of them out. Thank you for your democratic and respectful participation in a lively debate. It needs to be lively, we want it to be lively, and we also want it to be courteous. Now, it's difficult to square sometimes. I think people did it very, very well. And I'll hand over now to Jill to close us.
I think you should put your application in for Jonathan Nibble as replacement.
John Burke.
I'd like to...
No.
Yeah? Right. I'd just like to thank everybody who's come tonight to make this such a successful meeting. I'd also say we're overwhelmed by the number of questions that we received. A lot of very good questions. So we had to make a choice, and I hope we chose the right ones. But the discussion was great, and I'm really pleased with the way that the candidates here all participated and gave some very good questions and gave us things to take home and think about as well, and maybe kind of measure up what they've all said. If you do want to look at any of this meeting again and things that you might have missed, it has all been recorded, and it's going to be available on YouTube So please do take a slip which gives you the way, so you can find your way to this particular recording on YouTube. And the other thing to say is we did invite the UKIP candidate, as you can see. We tried several times by several different means, through his agent, through his central bod office, directly to his email address or addresses, and we had no response whatever. So we did try to get UKIP to make this a balanced debate. But I think it was a very balanced debate. I'm very grateful for all the candidates for coming tonight. And the last thing is, on your way out, if you could leave a donation to help cover the cost of the event, we'd be very grateful. So thank you very much.